That's a very important question, and the first thing to realize about is that the two epidemics are very important ones worldwide. So just by hazard, you may have two conditions, hepatitis C and diabetes, overlapping in quite few patients. But there is a second point, which is relevant, is that hepatitis C virus accelerates the development of diabetes in susceptible patients. So by consequence, you will have more patients, paradoxically, with diabetes in those who are at the same time infected with this virus. So it is very important to look for diabetes in patients with hepatitis C. So the first answer is yes, it is important, but just keep in mind you must look for diabetes in those patients who have hepatitis C infection and vice versa. Those who have diabetes, maybe it's better to look for other causes of liver disease. The second point is that there is an impact on the natural history of hepatitis C. Diabetes accelerates the fibrosis progression. So you end up more fastly to cirrhotic stages. Or you may increase the risk of developing hepatocellular carcinoma. On average, we estimate that diabetes patients double the risk of developing hepatocellular carcinoma when they are infected with hepatitis C virus. So now the question is how to manage these guys. Well, first of all, you have to, of course, complete the checkup. I mean, the diagnostic checkup has to be as complete as possible in terms of histology, biochemistry, and risk factors. Even family history taken is very important. The second, since hepatitis C virus may cause diabetes, or at least may cause insulin resistance, which may actually develop into diabetes, the first way to treat these patients is to treat hepatitis C virus infection. And there is very good data showing that if you eradicate the infection, patients will have less prone to develop diabetes in the long term. Actually, you reduce this risk by 2/3. I think it's quite a significant achievement, just by curing hepatitis C. Then, of course, you have to deal with diabetes. And since, as I said at the beginning, the two conditions may overlap, you cannot expect that you eliminate completely the liver outcomes just by eliminating the virus. So what you have to do is to deal with diabetes, which may cause steatosis and NASH on the liver. And the best way to do that is, in fact, a very cheap one approach, is to increase physical activity and lose weight, which is very easy to say, is very difficult to achieve. I understand that. But doesn't mean you have to not to prove, not to try at least. Physical activity is by far the best way to improve prognosis in patients with metabolic syndrome. It's been proven by very huge studies, even as compared to drugs. There's no question about this point. It's also very cheap. I would say also very democratic, if I can say that, right? But it's very difficult to achieve. And it's very difficult to keep patients adherent to these programs. I fully understand that. When you do have diabetes, though, lifestyle changes are not enough. We must treat diabetes. And there are very good drugs today. I would say that the old drug, like metformin, has been proven, because of its widespread use around the world, to improve outcomes. So in patients with chronic liver disorders, including hepatitis C, the use of metformin and a very, very tight control of blood glucose levels may reduce the risk of outcomes, including hepatocellular carcinoma. You can actually reduce by half the risk of developing hepatocellular carcinoma just by using metformin, which is a very old drug, as you understand. And the data available is actually essentially about metformin, because that's been used for so many years, and that's where we do have the most of the data of that. I would try to avoid older generation hypoglycemic drugs, like sulfonylureas. Those have been suggested even to increase sometimes the risk of outcomes. So patients with hepatitis C and diabetes, on the one hand, you should probably eliminate the virus. international guidelines start now to suggest that the best way, or at least let's put it that way, one of the most important indications to treat the virus, not just to avoid the liver-related deaths, but also extrahepatic conditions. And one of these is diabetes, of course. Then, of course, there is lifestyle changes, which include body weight reduction and increased physical activity. And last but not least, a very tight control of glucose levels by appropriate drugs. And the best drug we have now, the most studied in terms of liver outcomes, is metformin.